And when you start to get into that research, you really can't get away from looking at systemic and structural reasons for a lot of these disparities. Because if you look, we do have a lifestyle-related chronic disease issue in this country, but if you look, we're not all equally impacted by that in America. So, there's groups of people in this country that are far more impacted by things like type 2 diabetes and obesity and cardiovascular disease and stroke than other areas of the country. And we see that, low-income populations are twice as likely to have diabetes. They're 5 times as likely to report poor or low health status compared to their wealthier peers. And so when you're thinking through, like, how can we improve people's health, you have to look at those structural barriers to health. And so that's what I've been really focused on. So I think one of the things, to answer your question directly, that the MAHA movement is really doing is they're kind of distracting from all of that. They don't really talk about these disparities in healthcare. They don't really talk about these structural issues. They really are very focused on toxins in our food supply, distrust in scientists and regulatory agencies, and they take grains of truth and then they kind of exacerbate those grains of truth and weave conspiratorial narratives. And what you do when you do that is you get solutions that are not rooted in evidence and actually could make things worse.